Hello, this is going to be my Module 3 practical video assignment. So, first thing I have to do is show the working area. So, first I'm going to start off with the verbalization part, and then I'll move on to the demonstration part, like how we usually do in clinic. So, we're gonna have to improvise with the patient operator position. And I have sitting on a box with a little pencil sticking out to try to stabilize it. So I have the mandibular plane parallel to the floor, and I'm going to be sitting behind the patient's head at about 90 degrees. So then you want to we're going to describe the instruments. So the first one is obviously the hand mirror. And then we're going to use the anterior sickle, which is the SH67. This instrument is used in the anterior regions of the mouth, and it is used for removal of supragingival calculus only. It has two cutting edges, but the way to choose the proper working end is to look down at the tip. Have the tip facing you, and look at it and see which way it's bending. The way it's bending towards, you put the opposite side to the tooth. So if it's bending this way, you put this side to the tooth. Then next one, I chose the Mini 5 anterior Gracie curette, the SAS12. So this one has one cutting edge, and you choose the working end by seeing the way it wraps around the tooth. And this instrument is used in the anterior regions of the mouth, and it can be used for sub and supragingival calculus removal, but it's mainly used for subgingival calculus removal. And so you want to use a modified pen grasp for your instruments. But since it's the anterior region of the mouth, I just usually grasp the mirror with a palm grasp and retract the lip with my finger. So for proper adaptation of the instrument, you want to maintain the tip third of the cutting edge to the tooth, and make sure you select the correct working edge. And then you want to demonstrate the insertion of the instrument beneath the gingiva with using the curette. And you want to use light insertion pressure. Adjust the angulation to 60 to 70 degrees, and maintain the shank parallel to the long axis of the tooth. You want to remember the instrument is sharp, so it could damage the patient's tissue if you're not careful. And you want to make sure you're maintaining a intraoral fulcrum. You want to make sure that you're using exploratory strokes for your scaling strokes to locate the deposits and evaluate for calculus removal. And you also want to use the exploratory strokes for subgingival plaque removal, and apply light pressure for the exploratory stroke. And then you want to apply a working stroke for calculus removal, and you want to stabilize the modified pen grasp and with a fulcrum. And then you want to apply appropriate lateral pressure to actually remove the calculus. And you want to apply the pressure so you're moving in it towards the crown of the tooth, so the coronal region. And you want to maintain the proper adaptation of the blade at 60 to 70 degrees for the curette and 70 to 80 degrees for the sickle. And you want to make sure you rotate the blade to adapt the instrument properly. And you want to make sure you have proper wrist arm movement. And you want to we're going to demonstrate a vertical, oblique, and horizontal stroke. And at the end, we want to achieve a root surface that is biologically sound, so that tissue can reattach itself. So now I'm going to move on to actually demonstrating both instruments. So we have our mirror and our anterior sickle. So we're going to choose the proper working edge to start working away from me. So then you want to flip the instrument to work on the opposite side. So you want to work towards you now. So you flip the instrument, and now you can and you want to make sure you hear this biting sound. So you know that you're applying, so you know that you're applying the right pressure and that you're adapting the instrument properly. So now I picked up the Mini 5 anterior curette. See, this side wraps around the tooth, and this side doesn't. So this is the side we want to use. So you want to insert at a closed position. Then we want to flip the instrument to work the other way. So close. That concludes what we need to do for the Module 3 practical video. Thanks for watching.